Hello. It has been a minute since I have done a live. I apologize. Life be life in. But I am back, and my plan is to do these every Friday. Um, so moving forward, and then hopefully as my schedule changes within the clinic, and I kind of switch from being in clinic to all online, I'll be able to do these a little bit more often. I really enjoy educating, and I really help women, especially just kind of getting out of pain, in addition to like the weight loss and all that stuff. But getting out of pain is something that also, as a physical therapist, I enjoy. So for today, we're going to be talking about outer hip pain. If you are on my email list, you kind of already know this is coming. But before I kind of deep dive, I just want to know if you're joining live with me or if you are watching this on the replay, make sure you have a yoga block. This has been eaten by Glenn. Yes, I will buy a new one. Please don't come for me. And then you also need a foam roller. Okay. You might want a pillow or a blanket too, kind of depending on how dysfunctional you are. I say that in a positive way. But because of what we're going to go through in terms of the mobility and the release work, you want to make sure that you have something to support you, which I will explain. But before I get too into this, I just wanted to make sure that you have those things. Okay. So, outer hip pain. Let me grab my pelvis. Okay, so again, this is our pelvis here. What I'm talking about when I say outer hip, or if I say lateral hip, what I mean is this part right here. This is the front, this is the back, and then this is the outer part. Now, a lot of women, because of pregnancy or maybe some other issue, they get some hip pain where it's like on the side here, whether it's like if they're sleeping on their side, it hurts if they apply any kind of pressure, or you can get some radiating pain down the leg this way. People will tell me like I have pain right here, but like no matter what I do, I can't get rid of it. Sometimes people have pain like on the front here. Thinking of it as like your hip pockets. If you were to put your hands in your pockets, that kind of region, people have pain. Um, these are the people that sometimes will feel like they need to stretch their psoas, or they think that they have IT band syndrome, which is not really a thing anymore. They used to say, roll your IT band. And if you are new to this, your IT band is this whole side here. It starts up top on your hip here with these two muscles coming together, and then it attaches down at this place called your Gertie's tubercle on your leg. So, um, old school was they thought that, okay, if you're having hip pain, roll that out and you'll be fine. However, what they have found through cadaver studies and various other metrics, that you can't really change that band, okay? Just because the type of tissue that it is, rolling it out is really just uncomfortable. You really don't get much relief. Where you get relief is from attacking the muscle bellies that attach. So you have your TFL and then you have your glute medius. So both of these muscles kind of are on the outside here, and they attach, if my femur was kind of like, right here, okay, they attach on the femur. So they kind of come here and then sit here. So those muscles kind of help what we call abduct the hip. They help with flexion. They help rotate the hip as well. And that's a lot of times where women are struggling is because of the rotational piece, especially when you are pregnant and your abs, get stretched and they become weak or inefficient. And then the glutes have to try and stabilize. When the glutes, the big guys back here, as they try to create stability, what they end up doing is they'll clench, and then you kind of get this pinching sensation back here. It's kind of hard because my pelvis doesn't move that way, but it kind of flattens out here. Okay. And then again, create some dysfunction on the side of the hip. So what they have found through research is that a lot of times if you can kind of release the TFL and the glute med, and then you can strengthen the glute max, a lot of that pain goes away. The problem with postpartum women, though, is that sometimes it's not that simple. It's really not just that easy where, okay, do this release work, strengthen your glutes, you're good to go. A lot of physical therapists will tell you, do some stretching, strengthen your glutes, be on your way. You really want to make sure that you understand kind of what point that glute max is not firing, because it's an external rotator as well as it is a hip extender, meaning as my leg goes back, that's the glute max. And then as it rotates out to the side, that's also the glute max. And that's generally where women, they're over compensating. Okay. So what we're going to do today, it's kind of a lot of talk, but sometimes I feel like it's just a little bit easier if you understand kind of the why behind what we're doing, and understanding what exactly is the cause. I am more of a root cause person. Like I want to help you get to the root cause as to what is happening within the hip so that way we can really target that and fix it versus just treating the symptoms. A lot of times, no offense to other physical therapists or other trainers, but they tell you to stretch because stretching is a symptom, okay? If there has not been any kind of trauma to the muscle or to the body, if you have tension, it's generally an overcompensation. Something is underworking, so there's another muscle overworking, and you're getting this tension in that muscle that is presenting as tight because of that. And so you have to kind of figure out, okay, well, why is there extra tension? What muscle is causing that? And so that's kind of where we're getting at with this IT band issue. So a lot of words to say. We need to do some release work to the hips. Now, there's three things I'm going to take you through, and these are some of the go-tos that I use. I have gone through a few courses with a physical therapist named Sarah Duvall, through Core Exercise Solutions. And so what I am teaching you is stuff that I have been taught and I have used in practice for a while now. So we're going to start with just basic down regulation of the TFL. Big word, but really what it just means is we're just going to lay on something to calm that muscle down. The pressure pathway works faster than the pain pathway. So it's like when you hit your elbow at your funny bone and you grab your elbow right away to hold it. That's because that pressure is trying to override that pain signal. So a similar concept when it comes to our hips. You can take a foam roller, you can take a yoga block, you can take a little cross ball. It kind of just depends on your preference and how much tension, or let me rephrase that, how much pressure you want to put on the muscle. So what you're going to do is you're going to take, I'm going to use a foam roller or a block, I mean, you're going to find that muscle. So if you kind of are on your side here, you should notice that if I have my hip bone up here, okay, here's what's called your ASIS. All right. And if I kind of just go to the side, that's going to be where that TFL muscle belly is. Okay. And then it kind of inserts, if I keep walking my fingers down, there's another bone. Okay. That's on my femur, your greater trochanter. And then on the back side, if you kind of walk your fingers back up to this other back side of your pelvis, that's kind of where that glute medius muscle belly is. So we're first going to work on that TFL. You'll know if you have a TFL issue, if you kind of are sitting like this, put your hands on the front of your hips. And then if you kind of go out to the side to that muscle belly, if you kind of feel like it's really bulky. So again, if you're new here, I've had 8 knee surgeries. I've had 6 on my right side. So I have a lot of compensations on my right. I have a lot of TFL pain, I guess you could say. Probably why I'm well versed in this, because of the compensations throughout my whole kinetic chain. So for me, when I put my hands there, my right TFL is larger than it should be compared to my left side because of how much I use it inefficiently. Okay, I'm overusing it basically. So that's another test you can do just to see, okay, do I have a bigger TFL on one side versus the other? And if I push on it, does it feel comfortable? Because for me, it doesn't feel comfortable. But I'm also in constant pain. So I do a lot of these things to get relief, and they help for sure. But again, because of all the issues I have in my body, I'm always in some low level, grade level pain. So anyways, take a block. You're going to find that muscle belly. Okay, so you might have to kind of roll a little bit. And what you're going to do is just lie on it. Okay, you can kind of get comfortable. You can draw that top leg. Okay, and just lay on it. And you're going to practice your breathing. So a few weeks ago, we talked about 360 breathing. So what you're going to do is take a big breath. And when you breathe in, you want to think about breathing into that block or into that space. And then you can exhale doing your normal exhale, finding those lower abs, making sure that you're not engaging that TFL when you inhale, or you exhale, I mean, and then you can kind of go through a few reps like that. So depending on the client, or for me personally, depending on what I'm about to do, if I'm going to be doing squats, which is generally when my TFL flares up, then I will spend 2 to 3 minutes doing that. you'll know that the tension is releasing because you're going to have to kind of like wiggle around. You might be laying on it and being like, oh, I don't feel it so much anymore, which is a good sign. It means that you're releasing some of that tension in this in that muscle belly. So that is the release for the TFL. Next one we're going to go over is called a pelvis smash. So this one you are going to need foam roller, gosh darn, foam block, foam roller, and then a pillow, which I forgot to grab. So let me grab that really fast. Okay, so what you're gonna do is you want a pillow or something just to kind of support your neck. So, because we really want to make sure that we can kind of relax into this. If you're feeling like you're having to hold your head up, it's just gonna kind of kink your neck, which doesn't gonna feel good. And then it's also going to kind of take away from what we're doing. So, what you're gonna want to do is you're gonna want to lay on your side, and this is one you're gonna want a foam roller to start with. Okay, so we're gonna get my pillow, I'm gonna lay on my side, and then you're gonna want this bottom leg to be straight. Okay, when you're putting the foam roller, you want it to be kind of in between the bone. Like you want to make sure that you are on the muscle, that you're not just laying on that bone in the front or on the side, that greater trochanter like I talked about. Okay, so we're just gonna go ahead and lay here. All right, I'm gonna straighten out that bottom leg, make sure the foam roller's where I want it to be. And then I'm gonna bring this top leg forward. You wanna make sure that everything is, like these muscles in the front are squishy, okay? So for me, because of all the tension that I have, I'm gonna take that block, kind of put my top leg on that. Otherwise, I get too much of a pull here, and it's hard for these muscles to be squishy. So if you're going through any of these exercises, whether in this video or future videos, I'll talk a lot about props because they're really helpful if you are somebody like me who is super dysfunctional and having a hard time letting muscles go. That you can prop your body up and kind of cheat your way into them, but it's not necessarily cheating, it's just helping. But that's kind of how you think about it. So, anyways, you're gonna kind of find that spot, okay? And then you want to try and lift your lower abs, so the abs that are going to be on the foam roller. Kind of think about exhaling, trying to get that nice ribs over hips stacked position. Okay, so that way my ribs aren't touching the foam roller. I'm going to kind of reach forward to further get some back expansion with my ribs too. So then from here, we're just going to breathe. So you're going to take a big breath in. And when you breathe, you really want to envision like that breath is going into that muscle at the pelvis. Okay. And then you're going to exhale, find those lower abs. And then really just sink into that block. Okay. So another thing with the reach, when you reach, you want to make sure you reach through your armpit and not up above. Okay. So then reaching forward. And then exhale. Okay. And then as you do this, you want to go through like 5 to 10 breaths, but you should feel like you kind of just sink deeper and deeper and deeper into that foam roller. And again, you'll know because you might have to move around. It might become uncomfortable, which is okay after a while. You might not need the block later on. Okay, for me, I do because that's a little too much for me. But that's that pelvic smash. And when you're doing that one, you want to make sure that you're not feeling any pain or any kind of guarding. You want to make sure that you're just getting a nice lengthening along that backside, and really just relaxing that glute medius. Okay, so that hip muscle. You really want to be mindful of the hip flexors engaging, that you're not crunching down when you're trying to do that gentle exhale. Really just letting everything kind of melt. Okay. It's a very relaxing technique. It is somewhat painful in the beginning because again, you're just like melting into this foam roller. This thing that's like shoving into your hip. But if done correctly, it feels amazing. Like already I'm like, oh, like I need to do it on my other side because now this side I can feel more than I can feel this side. So that is the pelvis smash. And then the last one that we're going to go through today, this one is called a positional clamshell. So this is somewhat of a advanced exercise. And so these are not all the things I would do all in one session for you. I'm just trying to give you some ideas as to maybe where to start. Definitely start with that down regulation because that's going to be the easiest thing for you to figure out, and get some pain relief. And then I would go into that pelvis smash. That pelvis smash is going to require that you have the ability to get some back expansion. So make sure when you inhale, you can inhale into the backside of your ribs. You can exhale from the pelvic floor and lower abdominals without getting your hip flexors or your glutes, upper ab gripping, those kind of mechanics like we talked about a few weeks ago. And then this last one, the positional clamshell, this is going to be the most advanced of the mobility drills because it's going to require you to make sure that you can maintain that stacked position with the ribs over the hips using those abdominals. You have really good serratus anterior activation, which is again coming through my armpit, and that you can get the proximal hamstrings. I'm not sure if I've talked about proximal hamstrings before in these live videos, but part of the postpartum issues that women have are when those proximal hamstrings, which is like up by the hamstring that attaches on this part of the pelvis to pull it down and kind of act as giving you that posterior tilt. If women can't tap into that part of the hamstring, then this positional clamshell is going to be really challenging for them. And you're probably not going to figure it out correctly. So I'll talk later on about proximal hamstrings, but just for now, I'm going to go through the positional clamshell. So that way you have it kind of in your arsenal if things come up later on in life when you're like, oh yeah, I need to work on that. Or even if you try it now and you're able to figure it out and you can get some really good relief. So this one, you're going to need either like a box or a wall space. So I'm going to end up moving this computer so that way you guys can see me as I put my feet on something. I don't know how sturdy that is. So, come on with me. So, same setup, but now because of where the wall is, I'm going to do the other side. Okay. So making sure you guys can see everything. Okay, so this one, what we're going to do is this, when I was talking about the props earlier, you can start, let me backtrack. When you try this at home, you might feel like you need some props. Okay. And again, a prop can be like a towel, a blanket, a foam block, a foam roller, things of that nature, just to kind of help you get into the right position to really get that release work. And for this one, really target that glute max and that glute med in addition to like that top of the hamstring. When we're going through this exercise, before we even start, if you are feeling things in the front, you're feeling it down the side, if you are feeling pinching, if you are feeling some like pinpoint glute activation or your low back, then you are not doing it correctly and you need to stop. Okay, we don't want you to end up doing more damage just because you're trying to do this release work or this mobility. Okay, so just want to say that now before we like really get into this. So I'm gonna go ahead and lie down. Sorry, I keep moving my mouse around. Okay, so you have a pillow or something. We're gonna go ahead and lay on our side. All right, and then you want to get your legs into like a 90-90 position. That's why I kind of have to move around a little bit. So what you're gonna do here, okay, so you first want to make sure that you can kind of engage those abs, and then these abs should kind of just come up a little bit. So by kind of doing a little pre-brace, finding those lower abs to kind of get these bottom abs lifted up off the ground. Again, keeping everything on the bottom side squishy. And then with this top leg, what you're going to do is you're going to just kind of gently pull back on that proximal hamstring. So again, I'm trying to get this entire hamstring all the way up to my butt to engage without anything in the front. So if you have had an ACL surgery and they took part of your hamstring, like myself, this might be very challenging for you because you have a hard time engaging your hamstring because you don't have all of the tendon that most people do. So just be mindful of that. But what you're going to do is, again, once you kind of have that pre-brace, you're engaging your abs in the front to kind of set the front side of your pelvis. Big breath in, exhale. Okay. You should feel your abdominals and your ribs kind of coming up off of the ground a tiny bit. Nothing here. Okay. And then what you're going to do is you're just going to gently think about pulling back, really making sure that you're pulling back with this hamstring. Okay. And you want to make sure you pull all the way back, nothing in the front. Again, if you struggle with this hamstring activation, you're going to either feel it in your calf or you're going to feel it in this TFL because, again, how overactive that TFL is for the glutes and the hammies this TFL is going to try and engage to kind of help set the pelvis. And you really want to make sure that that doesn't happen. So if you're like me, then you can go ahead and just kind of keep your hand on the front here. All right. And then you're just going to, as you again, slightly pull back, my foot isn't necessarily moving. And I'm going really slow because again, my TFL wants to engage for everything. So I'm just going to gently, okay. Oh, I forgot this part. Making sure that you're staying stacked too. I kind of caught myself being backwards. So staying stacked, ribs over hips. Okay. And then you're just going to gently engage that hamstring, trying to pull back. Okay. The only place I should feel it is this hamstring right now. Okay. And then once you have that and you have your abs engaged and nothing else is firing, you're going to use this glute max to gently lift for, I don't know, like an inch. And then you want to hold that for 5 to 10 seconds and then relax. You want to make sure that, again, we're not feeling anything in the front. We're really feeling those abs and everything's going to be coming in from the back. Okay, so if you're feeling kind of pinching when you go to lift, you're not ready for this. Okay, because that means the femur isn't set correctly in your socket. So in real time again, big breath in. I'm going to exhale, find my pelvic floor, find those lower abs and pull up a little bit on these abs. Okay, now I feel like my ribs are over my hips. I'm nice and set. Everything is squishy here. I'm going to go ahead and pull back on that top leg, trying to find those proximal hamstrings, really trying to pull all the way up as best as I can, keeping my shins squishy, keeping my hip flexors, no pinching, nothing else. Everything is just relaxed, minus all of this up to my butt where my hand is. Once I find that, and then I'm going to just gently lift up, then hold. And if you do this correctly, like your butt will burn. Okay. Oh man, it's hard. So, but again, it's hard for me because I'm, a hot mess with all my issues and knee stuff. So, anyways, hopefully that was helpful. Kind of going through those 3 moves for your outer hip. Those are just the mobility and the release exercises. And then once you do those, you're going to want to follow up with some 90-90 breathing, focusing on that hamstring activation, because what you basically did is you kind of opened up the space at the hip, and now you want to reinforce that position. So one professor taught me to think of it, as mobility is taking the test, and then strengthening is turning in the test. So you don't want to do all that work and not follow it up with anything, because then you might not maintain it. And the whole point of this is to maintain it and not have pain and be able to do all the things, sit crisscross applesauce, play with your kids without having any kind of pain. So hopefully this is helpful. If it was, make sure you let me know so I know how to do more like this. If you want me to do like a part 2 of this where we go over the exercises that I would follow up with, you can let me know that as well. Maybe I'll just plan to do that next week. So if you watch it, then next week you will get the part 2 and know what exercises to do following it. And then you can start getting some relief in your hips, because a lot of moms, we do have hip pain, and it's annoying, and so that's part of my mission in life, is just to help every mom feel amazing in their body and reclaim it from pregnancy and birth, and just remember that they are still their own person. Yes, they are a mom, but they're still living life for the first time too. So let's live it as best we can. All right. Hope you guys have a great Friday, and I'll see you guys next week.